One of the biggest myth about the cholesterol is that cholesterol causes heart blocks and it results in heart attack. But actually, cholesterol is like our friend. It doesn't have anything to do with the heart attack. Many people keep giving you advice, especially the doctors, hospitals, lab people keep advising you to get your blood test done regularly, that too lipid profile. So lipid profile in the sense it includes triglycerides, cholesterol, HDL, LDL, VLDL, all those things. But this is being regularly being advised, and if you ask them, so why are we supposed to get this lipid profile done? Then they say this cholesterol and the triglycerides and also the LDL, these block our heart vessels and it results in heart attack. This was not there before. Before, in the sense, I am speaking about 20 or 30 years ago. Whenever you go to an hospital and consult any doctor, they used to advise like if you have if you had the symptoms of diabetes, they used to advise only the blood sugar level, nothing else. But now, if you go to hospital, even with the fever or any other complaints, or if you even if you go to meet a doctor just for general consultation, they advise you to get this lipid profile, the cholesterol, everything get done. So this started with the invent of this medicine, so called the statins, which are being used to treat the high cholesterol levels. That means to say, this investigation started with the companies and not with your health. Then what is this cholesterol? So cholesterol, so it is nothing but a storage form of carbohydrates. Our body, this especially among the nutrients, carbohydrates are the most essential nutrients that our body need for energy. The only source of energy for our cells is the carbohydrate. So this carbohydrate, storage form of a carbohydrate is called, we call them as fat. Again in the fat we have this cholesterol as well as the triglycerides. So cholesterol are nothing but storage form of energy that our body need. If you think something is not needed for our body, so like other than the nutrients, if something is we consume, it is not needed by our body, what our body does, it doesn't absorb that and it excretes that product. So but this carbohydrate being most essential, our body absorbs it, uses it, and anything in extra carbohydrate, our body keeps storing it that in the form of a fat. Then one more question is that why the body stores this carbohydrate when we are eating food very regularly, 3 times a day, 4 times a day, every day we are consuming the food, then why the body should store this carbohydrate in the form of a fat? So this is because probably what I think is this is because of the memory in our cells. So when our ancestors, our far ancestors who lived in the forest, so they used to eat once and for few days they used to fast. That means to say if they get food today, then another for few days they may not get the food. So these cells being very smart, they're smart enough to identify this and they started storing whenever they had food, they started storing, the cells started storing these carbohydrates thinking that another few days we may not get the food. So they started storing this carbohydrate that in the form of a fat. So and this memory, so which was there not only in our ancestors, in all the animals, so this memory continued. This could be the reason why our body stores only the carbohydrate in the form of a fat. Again, why I call this as a myth? So what is that? That is the heart attack is due to the high cholesterol level. It's absolutely a myth. So why I call it like that means I have examples, few examples also. A patient came to me so with his blood report where his cholesterol level was around 2000. We call 200 cholesterol as a normal. Anything above 200 we start giving the medications. Almost all the hospitals and the doctors keep advising medications if your cholesterol level is so more than 200, 250, 300, 400. If it is like that, they advise the medications. But this patient who came to me had a cholesterol level of around 2000. This was there for the past few years, but he was not on medications. He came with the reports saying that, sir, I am having this report for the past so many years and I don't have any complaints. Only thing I'm scared of is that the doctors, whenever I meet any doctors, they keep frightening me that, oh, if your cholesterol level is this much, you're surely you're going to get heart attack. So not only this example, I have one more example. So where triglyceride level of that patient was almost 4,500, unbelievable. The first time I have seen that such a high level of triglycerides, high level of cholesterol level. Again, that patient also had this report for the past so many years. It was absolutely fine, no symptoms at all. Again, very interesting thing is he underwent so many investigations. Angiogram was done, everything was done, and the vessels were absolutely clear, no blocks at all. With a report of 4,500 triglycerides, 2,000 cholesterol, their blood vessels are absolutely free of blocks. So again, not only this, I have so many patients, and even the statistics. We did a survey on so many patients who died of heart attack, and their blood reports were almost normal. They had the block, but their blood reports, especially the triglycerides and the cholesterol, were absolutely normal. That means to say, even more than 90% of the patients who died of heart attack almost had their lipid profile absolutely normal. Is it okay to have high cholesterol level in our blood? Even though this cholesterol is like our friend, it's a storage form of energy. Is it okay to have a high cholesterol level? Anything high is abnormal. If it is 500,000, then it's not normal, it's abnormal only. But never ever start these medications. It is especially for this cholesterol and triglycerides, so don't start some medications. Just follow the nature. So what the nature is saying, the cholesterol is nothing but a storage form of energy. That means to say you are supposed to use it in future. You're not using it today, but you have to use it tomorrow. So best way to reduce your cholesterol level is by fasting. Fasting in the sense, not few hours, 6 hours, 8 hours, 10 hours, 12 hours, I didn't eat anything. That is not the fasting. So fasting means 24 hours you are not supposed to eat anything, any nutrients other than the water. So 24 hours fasting has to be done. Two meals a day, early morning one meal and evening one meal. We call it as a fasting. No, it's not at all a fasting. Fasting means 24 hours, so not consuming any of the nutrients. So you can try this. Do fasting 24 hours. Before doing the fasting, check your triglycerides, cholesterol level. Then do fasting 24 hours fasting just with water without any nutrients, and after one day itself you can repeat your cholesterol level, you can repeat your triglycerides level. 50% of it gets reduced. The only way, the only route of reducing your cholesterol, your bringing this lipid profile normal is by fasting only. Especially the medicines what we consume, that is the statins, they have too much of side effects, adverse effects, many complications. If you keep on taking this cholesterol medicines, so by 2 or 3 years you are going to develop this diabetes. So my advice is avoid taking medications, especially for to reduce the cholesterol level. Finally, cholesterol is nothing but a storage form of energy. It is for our health, it is for our benefit, but for the doctors, and for the hospitals, it is just a business. Be happy, stay healthy. Namaste.